All right, so let us continue studying because we only have so much time. And yeah, okay. So OneNote, there we go. Just made this, so I don't know if it'll come up. And I don't understand, like, how the hell. I don't get it. There we go. Okay, so I don't really want to talk, so I'm wondering if it will talk for us. And no, I won't. Jeez, why does it do this? Okay, so this is what I'm going over. I'm going to let it transcribe for us then. Okay, I don't know, this might be really loud.
1. Risk factors for surgical complications. From the slides and nursing textbooks.
Okay.
Key risk factors. Age. Older adults have decreased physiological reserves, increasing the risk for complications like infections, poor wound healing, and anesthesia-related issues.
Poor wound healing. Okay, so the risk factors for surgical complications. So she has 9 questions regarding the surgical client. And I had given her the whole slide of the surgical client, and then I asked her to go, and she's been pulling it out of a medical surgical book. So that's cool. I'm calling ChatGPT a girl. Anyways, so the question is risk factors for surgical complications, okay? So the risk factors would be the age, nutrition, obesity, smoking, pre-existing conditions like diabetes and infections, and drug use, okay? So age, older adults have decreased physiological reserves, increasing the risk for complications like infections, poor wound healing, and anesthesia-related issues. Nutrition, poor nutrition, especially protein deficiency, can impair wound healing and immune response. Obesity increases the risk for surgical site infections, delayed wound healing, and respiratory complications due to poor ventilation. Smoking impairs oxygen delivery to tissues, affecting healing and increasing the risk of respiratory complications. Pre-existing conditions like diabetes, leading to poor wound healing and a higher risk for infections. Active infections increase the risk for post-operative complications like sepsis. So pre-existing conditions, right? And then drug use. Chronic use of substances such as alcohol, opioids can impact anesthesia response and pain management. So let's see. Nursing interventions would be to conduct a thorough pre-operative assessment to identify and mediate these risk factors, encourage smoking cessation before surgery, and optimize nutrition pre-operatively, including managing blood glucose levels for clients with diabetes. Okay, so informed consent. Let me see if they'll actually read the informed consent part. Let's see.
Informed consent.
From the slides.
Definition. Informed consent is the client's voluntary agreement to undergo a surgical procedure, having been informed of the risks, benefits, and alternatives.
Okay, so informed consent is the client's voluntary agreement to undergo a surgical procedure, having been informed the risk, the benefits, and alternatives.
Nurse's role. Witness the client's signature on the consent form. Confirm that the client understands the information provided by the healthcare provider. Ensure that the consent is obtained before administering any preoperative medications.
Okay, so some things that we need to make sure of with the informed consent. One is we need to witness the client's signature on the consent form. Two, we need to confirm that the client understands the information provided by the healthcare provider. Do they understand what the healthcare provider told them? And then three, ensure that the consent is obtained before administering any pre-operative medications, okay?
Medications. Additional information from textbooks. Nurses must not obtain consent for the surgery itself. That is the surgeon's responsibility. However, nurses ensure that the patient has a clear understanding and is signing voluntarily.
Yes. Okay, so the nurse's role in each phase of the perioperative period. Okay, so this is, okay, I'll let you go.
Voluntarily. 3. The nurse's role in each phase of the perioperative period. From the slides. Preoperative phase. Perform a complete preoperative assessment, e.g., allergies, medications, vital signs. Provide education on what to expect before, during, and after surgery. Encourage splinting, use of the incentive spirometer, and deep breathing exercises to prevent complications like atelectasis.
Okay, so the nurse's role in each phase of the perioperative period. Okay, so there's three phases. We have the pre-operative phase, the intraoperative phase, and the post-operative phase. Okay, so with the perioperative phase, we're performing a assessment, right? We're performing we're performing a complete perioperative assessment. Making sure if they have allergies, checking their vital signs, that kind of thing. Provide education on what to expect before, during, and after surgery. I don't know about that because we can, it says it's from the slides, but okay. Encouraging splinting, use of incentive spirometer, deep breathing exercises to prevent complications like atelectasis. Okay. What is splinting? See, this is why I have to go back and forth. I have no idea. What is splinting? And why do we need to encourage splinting, incentive before or preoperative phase? Okay, so I guess it's correct. Splinting is a technique used to reduce pain and protect a surgical incision, especially in the chest or abdomen during activities like coughing, deep breathing, or moving. It involves the patient holding a pillow or folded blanket firmly against the incision site to provide support and minimizing pain when coughing or breathing deeply. Splinting is important because it reduces pain by applying pressure with a pillow or other soft object. Splinting helps stabilize the incision site, reducing movement that can cause pain. It prevents complications such as the risk of wound dehiscence, the surgical incision opening up, and evisceration, which is the internal organs protruding through the incision. Encourages deep breathing and coughing. After surgery, patients often have shallow breathing due to pain. Splinting helps them cough and take deep breaths, which are critical for preventing complications like atelectasis, collapsed lung tissue, and pneumonia. An incentive spirometer is a device used to help patients take deep breaths. It encourages patients to inhale deeply, which improves lung expansion and keeps the airway clear. The device has a mouthpiece attached to a tube and a chamber with a ball or piston that rises at when the patient inhales. In summary, splinting and incentive spirometry are essential techniques taught to patients in the perioperative phase to enhance post-operative recovery. So it's taught to patients in the perioperative phase to help with the post-operative recovery. Okay, I get it. Okay. So nurses' role in each phase of the perioperative period. We have the pre-operative phase, which we perform a assessment, vital signs, allergies, that kind of thing. We provide education on what to expect before, during, and after surgery. We encourage, so we teach them or encourage splinting, the use of incentive spirometer, and deep breathing exercises to prevent complications that I was talking about. So in the operative phase, so intraoperative phase, we have the circulating nurse. Okay, we have I can't speak right now, my throat. Ugh. Hold on. Circulating. It's okay. It's fine. That's why I have this to read it for me. Intraoperative phase. Hold on, it's taking a minute. So in the intraoperative phase, we have the circulating nurse and the scrub nurse. The circulating nurse encourages patient safety.
Intraoperative phase. The circulating nurse ensures patient safety, monitors vital signs, maintains sterility, and coordinates with the surgical team.
Okay, so she's like walking around looking at the patient's safety, vitals, sterility, coordinates with the surgical team. And then we have the
team. The scrub nurse prepares and hands instruments to the surgeon while maintaining sterility.
Okay, so the scrub nurse prepares and hands instruments to the surgeon while maintaining sterility.
Sterility. Postoperative phase. Assess for complications, e.g., respiratory status, surgical site, pain levels. Monitor for signs of hypovolemia, atelectasis, and wound dehiscence. Provide pain management and patient education on discharge instructions.
Okay, in the intraoperative phase, this is going to be, so then they have the, oh wait, we're talking about the post-operative phase right now. Okay, so the post-operative phase, we assess for complications such as like respiratory status, surgical site, pain levels. We monitor for signs of hypovolemia, atelectasis, monitor signs of hypovolemia, atelectasis, and wound dehiscence. I'm tired. Provide pain management and patient education on discharge instructions. Provide pain management and patient education. Okay. Manifestation of surgical complications. Okay. Was that one of the things? Hold on. Okay, so the question said, okay, risk factors for surgical complications, informed consent, the nurse's role in each phase of the perioperative period, manifestation of surgical complications, nursing interventions to prevent complication of surgery. Let it speak, let it go.
Instructions. 4. Manifestations of surgical complications.
From the slide.
From the slides and textbooks. Postoperative nausea and vomiting. PONV can lead to dehydration and electrolyte imbalances. Venous thromboembolism, VTE swelling, redness, or pain in the legs. Prevent with mobility and compression devices. Atelectasis, shallow breathing post-surgery, can cause lung collapse. Encourage deep breathing and incentive spirometry. Wound dehiscence, separation of surgical incision, often due to strain, e.g., coughing. Hypovolemia, decreased blood pressure, increased heart rate, and reduced urine output. Interventions. Early mobilization, adequate hydration, and pain management are key in preventing these complications.
Okay, what was that? Manifestations of surgical complications. Okay, so manifestations of surgical complications, we have post-operative nausea and vomiting, venous thromboembolism, right? Atelectasis, wound dehiscence, hypovolemia. Interventions would be early mobilization, adequate hydration, and pain management, and are key in preventing these complications. So, we have, so post-operative nausea and vomiting can lead to dehydration and electrolyte imbalances. Swelling, redness, or pain in the legs prevent with mobility and compression devices. So like DVT, right? Atelectasis, shallow breathing can cause lung collapse. So that's why we encourage deep breathing and having that incentive spirometer. Wound dehiscence, separation of the surgical incision due to strain. That's why we do the splinting. Hypovolemia, decreased blood pressure, increase heart rate, and reduce urine output. So we need to have them ambulate early on. Adequate hydration and pain management is key to preventing these complications. Okay, so the last one is nursing interventions to prevent complications of surgery from the slides. So encourage early ambulation to reduce the risk of DVT or VTE. VTE is what? Venous thromboembolism. And lung expansion as well helps with that. Use of incentive spirometry to prevent atelectasis. Educate on proper splinting techniques to prevent wound dehiscence. Monitor for signs of infection like redness, warmth, or discharge at the surgical site, and maintain proper positioning. Okay. I'm going to let her go and do the questions because I did ask her to do the NCLEX style questions.
NCLEX style questions. Question 1, multiple choice. A nurse is preparing a client for surgery. The client asks about the purpose of signing the informed consent form. Which response by the nurse is most appropriate? A. It ensures that you understand the risks, benefits, and alternatives of the surgery. B. It means the surgeon has explained the procedure in detail to you. C. It allows us to perform the surgery immediately without further delay. D. It confirms that you will not experience any complications during surgery. Correct answer, A. Rationale. Informed consent ensures the client understands the risks, benefits, and alternatives of the procedure. The nurse's role is to confirm that the client comprehends the information and voluntarily consents. Question 2. Select all that apply. Which of the following are risk factors that increase a client's likelihood of surgical complications? Select all that apply. A. Age. B. High protein diet. C. Diabetes. D. Smoking. E. Regular exercise. Correct answers: A. Age, C. Diabetes, D. Smoking. Rationale: age, diabetes, and smoking are risk factors that can impair healing and increase the risk of surgical complications. A high-protein diet and regular exercise generally promote healing and reduce complications. Question 3. True/false? The nurse is responsible for obtaining the client's signature on the surgical consent form and explaining all aspects of the procedure. Correct answer, false. Rationale. The surgeon is responsible for explaining the procedure. The nurse's role is to witness the client's signature and confirm understanding. Question 4. Multiple choice. A client in the postoperative unit is experiencing shortness of breath and decreased oxygen saturation levels. The nurse suspects atelectasis. What is the priority intervention? A. Encourage the client to use an incentive spirometer. B. Increase the client's intravenous fluid rate. C. Administer pain medication. D. Place the client in a supine position. Correct answer, A. Rationale. Using an incentive spirometer helps expand the lungs, preventing atelectasis. It is a priority intervention for improving oxygenation. Question 5. Select all that apply. Which nursing interventions can help prevent venous thromboembolism, VTE, in a postoperative client? Select all that apply. A. Early ambulation. B. Deep breathing exercises. C. Application of compression stockings. D. Increasing fluid intake. E. Frequent turning and repositioning. Correct answers: A. Early ambulation. C. Application of compression stockings. E. Frequent turning and repositioning. Rationale: early ambulation, compression stockings, and repositioning help promote circulation and prevent VTE. Deep breathing exercises and increasing fluid intake do not directly prevent VTE, but are beneficial for overall recovery.
I think that's it, actually. Yeah, nice.